Alright, this is the bloodway path for deoxygenated blood. First, it comes in through the superior vena cava and the inferior vena cava, and it goes to the right atrium. Then from the right atrium, it goes to the left ventricle. Now, once it's done that, the left ventricle kind of like contracts and like squeezes itself, and it goes to the pulmonary valve, which is like down here somewhere. Yeah. And it goes, through here to the pulmonary valve, and that goes to the lungs. Now, once it reaches the lungs, of course, they oxygenate the blood. Then, once they've done that, they go into the left atrium. Now, once they go to the left atrium, that goes into the left ventricle. And then the left ventricle, it squeezes, it contracts, squeezes itself, and the aortic valve opens up, and it brings the oxygenated blood to the aorta, which that then goes to the rest of the body. Okay. Angina is a disease that causes chest pain or discomfort due to reduced blood flow to the heart. Now that you can see right here, that there's plaque that's, it's preventing blood from properly circulating through the veins. Now, patients with angina often describe the feeling of, squeezing, pressure, tightness, or heaviness in their chest. Alright. Having angina is a primary symptom to coronary artery disease. Now, that is a cardiovascular condition in which, the buildup of plaque, there's buildup of plaque in the artery walls, as I mentioned before. And that prevents the heart from getting, blood correctly. So, as you can see, down here, the vein is, not purplish, dark red, because, it's not getting as much blood as this other part, which is brighter red, which is getting blood. Alright. Now, when this, plaque, happens, it builds up in the blood vessel, that's called atherosclerosis. Now, as I mentioned, it can block the blood flow, to the heart and muscle, to the heart muscle, because, the heart's a muscle, it pumps blood. And when that happens, that can actually increase the patient's risk to a heart attack or heart failure. Alright. Now we move on to atherosclerosis. Now that in of itself is a problem. It's a disease. Now, that is a cardiovascular disease that is basically the buildup of this plaque in your veins, your blood vessels, that prevents, blood, red blood cells, white blood cells, just blood in general, from getting to your body properly. Okay, now because of this plaque building up, that can cause damage to the inner artery wall, which is this one right here that's getting, squeezed and damaged. Now, this damage can cause artery stiffness and development of fatty, deposit, the plaque. Now, worst case scenario when it comes to this plaque buildup is that it can completely stop the blood flow of, a major artery. So, when that happens, since blood isn't getting to your heart or your brain, you could get a heart attack or a stroke. Now, a couple of reasons why someone might develop atherosclerosis is because of, of having high cholesterol, diabetes, obesity, smoking, high blood pressure, and just aging in general. That's what, can cause atherosclerosis. Okay. Now we move on to myocardial infarction, aka a heart attack. This is a serious condition that happens when blood and oxygen supply to the heart is reduced. Now, the reason why that happens is because of atherosclerosis, which is, again, the buildup of plaque in the coronary arteries. But this doesn't necessarily have to be in a coronary artery. It can be an artery from elsewhere in the body that gets ruptured because of the because of the plaque that builds up. And now, when that happens, it can form a blood clot. the blood clot can break off and travel to the heart and get lodged in smaller coronary arteries. Okay, now, because that happens, we get all this death of heart muscle. Like, all of this part, all of this, like, black, kind of, like, bruised looking, like, part of the heart, that's all dead heart tissue. Now, that's what happens when the, blood clot, like, breaks off, hits other coronary arteries. Now, because of, decreased oxygen and the death of heart muscle, patients with myocardial infarction may experience immediate chest pain or arm pain, increased heart rate, sweating, fatigue, and nausea. Okay, now we move on to aortic valve stenosis, which is this right here. Now, this is a heart condition that occurs when the aortic valve narrows, primarily obstructing blood flow across the valve. Now, the reason AS happens is because of calcification, which means that the valve cannot completely open. Now, the reason that happens is because of age. The valve can't open properly, and that stiffens the valve and narrows the valve opening. Now, people or patients that have AS probably won't experience any symptoms, immediately. AS usually takes a long time to develop, many years because of age. That's how you get this. But patients that have more advanced AS have symptoms of chest pain, dizziness, and fatigue during exercises, congestive heart failure. Those are all common symptoms. Okay. Now we move on to patent foramen ovale. Now that is this hole right here. If I can show you right here. Now that's a hole present in the wall between the two upper chambers of the heart, or atria. Now this is congenital condition, which means it's, you've had this since birth. Now, a PFO is typically asymptomatic and harmless. Like, if you have this, more likely than not, you're going to be fine. Now, like 25% of the population have this, disease. But most people that have that don't actually know they have it, because having like actual conditions from this are very rare. But if you do have this, you can have some symptoms, like some negative side effects, which can cause strokes, migraine headaches, and heart attacks. But those are very rare instances. Now, the exact cause of a PFO is not very well understood, but it's probably genetics that causes that, or that has like some sort of like part in it after a baby is born. Now, the pressure of blood pumping through the heart usually causes a foramen ovale opening to close, but in some cases it does not. Now that's, I'm guessing, the 25% that doesn't close. Most PFO defects are between 3 and 6 millimeters in diameter. Now for the last one. Now this is congestive heart failure, or CHF for short. Now this occurs when your heart cannot properly pump enough blood to your body, as shown here. The deoxygenated can't get to the pulmonary arteries. This can be caused by a variety of disorders, including structural defects with the heart valves, decrease of the heart muscle, or cardiomyopathy, abnormal heart rhythms, arrhythmias, and a heart attack. In congestive heart failure, the walls and ventricles are thin and weak. They are unable to adequately pump blood out of the ventricles. Instead, blood remains in the ventricles and reduces the amount of blood that reaches the rest of the body and lungs during each beat. So instead of the blood naturally going to your lungs, which is what this and this would be going to, it would be stuck in the ventricle. And same for the oxygenated blood, which goes in through here, and gets stuck in this other one, in the left ventricle. So the right ventricle has deoxygenated blood that's stuck in it, and the left ventricle has regular oxygenated blood that's, just sitting there, which should be going to the rest of your body. Now, factors or causes that increase CHF include high blood pressure, coronary artery disease, metabolic syndrome, diabetes, and structural abnormalities in the heart. Patients with CHF commonly experience symptoms such as fatigue and weakness, shortness of breath, swelling of lower limbs, decreased alertness, and reduced ability to exercise.